Today is National Stroke Awareness Month, and here now sponsoring our segment from Carle with tips on recognizing the signs of a stroke is Dr. David Kimball. Welcome, doctor.
Thank you. Thank you very much for having me.
Absolutely. We're glad to have you, and you are a bit of an expert when it comes to strokes.
I treat a lot of strokes. I see a lot of strokes, a lot of people who are having strokes. Yeah.
Well, let's talk about, I guess maybe it's the obvious, but for some people that don't know, what is a stroke?
Yeah, that's a really great question. So essentially, stroke, like all organs in your body, you have to get blood flow to your organs, your kidneys, your heart, your brain, for example. If you get decreased blood flow to one of those organs, for example, your heart, people say that you have a heart attack. So if you have decreased blood flow to part of your brain, this is called a stroke.
So it's a similar principle of a heart attack. It's just in a different part of your body.
Yes.
Now, what is it about identifying a stroke that's important? I know you guys have an acronym, BFAST, that you guys like to use.
Yeah, B-E-F-A-S-T, BFAST, yes. So this is kind of just some general things you can use to recognize a stroke. If someone's having balance problems, if someone's eyes are not really working great, you know, sometimes patients will look towards the side of their stroke, which is strange but true. And then maybe if your face tends to droop, like one side of your face will start to droop, and that's weird and not great. Or if your arm, one part of your arm starts to maybe not work so well, that's A.
So if you're with somebody, you could actually ask them to raise up both arms.
You could.
Kind of
do
a little diagnosis test there.
Yes, you could. And then speech, of course. Some patients, depending on the side of their stroke, will not be able to talk at all or not really be able to understand their speech, so it's pretty alarming, or they could have slurred speech. So, yeah, that's...
And then the T is for terrible headache.
A terrible headache, yes. Terrible headache is also a sign of a type of a stroke, but also T kind of sometimes stands for timing, which is, you know, patients need to get to the hospital as fast as possible. Stroke is really critically important, so they really need to come to the hospital as fast as they can. Yeah.
Well, since you're touching on that, what is if you do suspect that there is a stroke, maybe you have some of the symptoms and you're not sure, I mean, what do you recommend that people do? Call 911 or get somebody to take you right away? What is the recommendation?
Yeah, that's a really great question. So yes, call 911. Something that people don't think about that is oftentimes effective is lying flat, putting your head down. Isn't that interesting? You can lie flat.
Help with the blood flow?
Help with the blood flow to your brain.
So
it's kind of like a hose.
Some of the pressure.
Exactly, right? If the hose is up tall, it's hard for the blood flow to get there. But if you're flat, the blood can go.
That's interesting. So you could actually start helping yourself, call 911, and then lay down.
Yes. Otherwise, there's really no great therapies until you get to the hospital. So you need to go to the hospital.
Well, let's talk about other ways that we can lessen the chances or even prevent a stroke from happening.
Sure. Yeah. So, you know, essentially living a healthy lifestyle, not smoking, having your blood pressure under control, having your cholesterol under control. These are some of the things that smoking is a big one.
Yeah.
Believe it or not, yeah.
Yeah, you're not doing yourself any favors.
Yeah.
What about things that can't be helped or changed, like age or genetics or different things like that?
Yes. If people in your family have had strokes, the older you get, you're kind of more prone to strokes. Also, there's cardiac risk factors. Oftentimes, these very large strokes will come from the heart. So speaking with your primary care physician and making sure that everything's working properly with your heart, and that's a good way of preventing a stroke as well.
Now listen, if somebody does have a stroke in our area, anywhere you are, call 911 and go to the hospital. But I think it's worth noting, you guys have one of the most powerful MRIs in the country.
We do. It's pretty remarkable. One of only a handful in the world. We have an MRI here at Carle called a 7 Tesla MRI. Tesla, it's a car company and other things, but also it's a magnetic field strength, and so it's one of the most powerful tests, one of the most powerful MRIs in the world, and we have that here at Carle. Nowhere else in the state of Illinois. Only a handful of places in the country has this, so Carle's pretty neat in that regard. Yeah.
That's incredible. Well, if you are interested in getting more information on Carle Hospital, you can head over to the website at carle.org. They even have a test where you can test your signs of a stroke with their online quiz. And we will get you all of that information on our website at ciliving.tv. After today's show, we do appreciate them sponsoring our segment this afternoon.